it's always really important to understand what the provider orders and exactly what it is, because it'll help you get a connection and think critically about what should be done first, second, and so on. So blood cultures. What is a blood culture? Well, it's actually to see if there's any bacteria or fungi growing in the bloodstream. It's a venous blood draw. They draw the blood using as clean of a technique as possible. You add it to a culture media, and then it goes to the lab and you wait. It grows out bacteria or fungi, which is less common. You'll see more bacteria. So how is it collected exactly? It depends on what the provider orders. It's usually collected in approximately 2 sets. So there'll be 2 vials or culture media, it's called, and usually there's 2 of them. Now, sometimes they order 3. Let's just say, for example, the patient's already been on antibiotics and a culture wasn't drawn. Sometimes they have to draw, or it's suggested they draw 4 to even 6 tubes to see if they can capture the bacteria in the bloodstream because antibiotics have already been started. That's not an ideal situation. The ideal situation is to get the blood cultures done as soon as possible, usually at the same time or 5 minutes apart to a half hour apart. Again, this varies. It could be in the same site, although most commonly they're done in different sites, so it just depends.